The AIDS Crisis in the U.S. by Destiny Griffin. January of 1980 marked some of the first occurrences of what was considered at the time to be a rare disease plaguing homosexual men in the United States. A parasitic form of pneumonia called pneumocystis, along with a rare skin cancer form called Kaposi sarcoma, were both being found in dozens of male patients by mid-1981. Gay men made up 94% of the patients who made their sexual preference known, along with the diseases occurring irregularly, sometimes in combination and sometimes apart, and being fatal to a number of its patients. The disease center could not pinpoint a cause for the diseases, and in turn established that the occurrence of in the general population was extremely unusual. By June of 1981, the CDC released its references to the first set of cases, 5 patients in 2 different hospitals in LA, all with identical diagnoses of CMV infections, pneumocystis, and candidal mucosal infection. Other than being homosexual men, the patients had no further similarities and did not know each other or each other's partners. The diagnoses in the cases showed that the onset of illnesses in the patients spanned from October 1980 to May 1981, with 4 of the 5 men being completely healthy before these infections, and resulted in 2 of the patients dying soon after contracting the disease. With the only gay male victims to start, the collective of illnesses came to be known as gay-related immune disease, or GRID. Charles E. Rosenberg states in his journal that the managing of response to epidemic could serve as a vehicle for social criticism as well as a rationale for social control. This concept seemed to ring true for the treatment of AIDS in the United States. In a recalling of how the AIDS virus was handled when it first began to be reported in the country, medical doctor Donald P. Francis writes that the Reagan administration kept the CDC from responding appropriately to the disease, which had already come to be known as highly dangerous and highly transferable. Francis had already been working in the CDC for 3 years before being called to join the center's in-house team of experts working on what to do next about the disease. 6 months before the first reports of AIDS came to be, the Reagan administration settled into the White House, and no time soon would they understand the government's role in helping to control the spread of the disease. A table documenting the cases and deaths by each year shows that in 1982, 1,168 adult cases had been reported with over 450 deaths. What started as a disease being solely identified in gay men soon became a, quote, highly fatal disease caused by a transmissible infectious agent, of which the Reagan administration would only allow partial measures and provided inadequate funding. With the disease spreading from only infecting gay men to affecting others like users of intravenous drugs, it was soon named acquired immunodeficiency disease. Riddled with concern for the continued effect of the disease on the country and the lack of adequate government funding, resources, and action, multiple people wrote letters detailing their frustration with the handling of the virus. In a letter from Donald P. Francis to the Assistant Director of the CDC, Dr. Walter Dowdell, Francis insists on a change in government action and writes that the lack of adequate funding has severely restricted the work able to be done in regards to the virus and has in turn caused a loss of hope in AIDS workers all over the country. Gay advocacy groups and community organizations provided services where they could, and also insisted for a change in government contribution to dealing with the virus. In a testimony before a congressional committee in 1983, Executive Director of the National Gay Task Force, Virginia M. Apuzzo, states that the government's failure to respond to the crisis enabled the disease to cause a public panic and has also enabled homophobes to use the crisis to attack the gay and lesbian community. This accusation can be supported by sociologist Philip M. Kael, who specializes in ethnicity and minority relations. Kael writes in his article that AIDS victims will likely be blamed for their illnesses due to the framing of AIDS in a moral and religious viewpoint. Apuzzo's statement also left the government responsible for the nation's low blood supply, a result of, quote, government failure to investigate the transmissibility of AIDS through blood, to develop a marker for AIDS in blood, to test surrogate markers, or to study the safety of the blood supply in giving blood. Executive Director of the National Hemophilia Foundation, Alan P. Brownstein, and Mel Rosen of the Gay Men's Health Crisis in New York City also gave statements in front of the Congressional Committee in 1983 touching on the public's fear of the virus, and sensationalistic reporting and misinformation, all enabled by the government's handling of the crisis. In their book called AIDS: An Expanding Tragedy, the United States National Commission on AIDS informs on how the excuse of AIDS being just one disease is often used to support the suggestion that funding be put towards other concerns, and further writes that in 1993, over a decade after the first reports of the virus, underfunding has gotten worse. AIDS patients and workers recount their experience with the syndrome. In December of 1981, Michael Callan was diagnosed as an immune deficient after being concerned with having similar symptoms as those he'd read about in the gay press. He reports telling his parents after their diagnosis that he was, quote, going to die. He reports being hospitalized with cryptosporiosis in the summer of 1982 and re-hospitalized in the fall for a suspected pneumocystis pneumonia, which turned out to be bronchitis. He testified that after coming to believe that he could beat the virus, his story is now, quote, waiting around for infections, checking himself every morning for Kaposi sarcoma lesions, and waiting for information about the disease to be forthcoming. He died on December 27, 1993, from causes related to the disease. Anthony Ferrera of Washington, D.C. referred to AIDS as another closet to come out of. Ferrera reported going through a deep depression when he was diagnosed with Kaposi sarcoma in 1983 after having lymphadenopathy. His depression lasted a month before he decided that having a better attitude was the only way he could have a chance of surviving this syndrome. Roger Lyon of San Francisco, California, who was diagnosed with Kaposi sarcoma in February of 1993, stated that he lives in fear of what's to come, and that he too waits for something to happen to him or find something wrong. He reports that so many of his friends and people that he knows with the syndrome are unable to work or go about their daily lives as usual. Michael Callan also brings up the point of the lack of confidentiality as an obstacle to AIDS research and prevention. Victims of the syndrome have no assurance that in admitting to illegal actions that may have caused them to contract the disease, they will not face legal consequences. If they were reassured of this, they could provide truthful information which will help in the research and development of preventative measures for the spread of the syndrome. Healthcare workers like Lorraine Tybod were also affected by the virus and the lack of information on the disease and how it spread, and also the lack of training on how to prevent the spreading of the disease in their workspace. In 1991, a fellow nurse informed Tybod that she had accidentally stuck a patient. What made the situation worse for the fellow nurse was knowing that there had been a safety measure, a self-shielding IV starting kit, which the nurse had been denied access to. This matter gave healthcare workers great pause that they were able to be denied safety measures that could be beneficial for themselves and patients. She recalls the fear of contracting AIDS that was heavy amongst their workspace, and after she'd heard about the incident, soon the workers filed a grievance, which Tybod recalls was the first time all three major unions at the hospital had ever come together to file one.
At the time I started nursing school, I thought nursing had a lot to do with nurturing people and being nice to them and rubbing their backs. I didn't really have a very good conception of the types of technical skills that would be involved in my job. I think it took a long time for me to understand that AIDS was something that I could catch, but not only that I could catch, but that I could bring home to my husband. Sometime in 1991, one of the nurses came to me. Basically, she said that she had, a few months before, accidentally stuck a medical student, that she had been devastated by the experience, that the medical student had been devastated by the experience. But that wasn't the worst of the story. The worst of the story was that one of her friends in the emergency room had showed her a device, a self-sheathing IV starting kit, that could have prevented the accident that she caused. She was very enthusiastic. This is great. I'm going to get these into the area where I'm working. And she called up the central supply, and she asked for the device and was told that, no, I'm sorry, you can't have it. She was furious. She couldn't understand how could they have a safety device in central supply and not give it to me. Healthcare workers who stand up and say, I have relationships between sharp objects and people that I don't know. I need to be protected from AIDS. There are things out there that can help me. To some extent, I feel like self-sheathing needles and needleless IV systems, those are my condoms. Those are the things that protect me and my relationship with patients and protect my patients We filed a grievance, which was the first time in my memory that we've ever filed a joint grievance between the three major unions at the hospital. I personally had presented the CEO of the hospital with petitions that were signed by over, I believe it was 600 people. I have had many petitions signed in my life, but I think that was one of the hardest ones. It wasn't because people didn't want to sign. I didn't have a hard sell for a minute. Everyone wanted to sign a petition. What was hard about it is that everyone wanted to stop and talk to me about their fears of contracting AIDS. They wanted to tell me the time they'd been stuck, the time they were afraid to go down and get a test. They wanted to tell me about the person they knew who'd gotten stuck, who had a friend, about the device that fell on the floor, about the thing they almost found in the bed. I began to realize there was this huge amount of just free-floating fear in the hospital that had to be directed somehow. What we won out of that grievance was not only the Criticon placement throughout the hospital, we won the first major training of people to use safety devices in the hospital, and we won an ongoing committee to evaluate all new technology that's coming onto the market. And for us, I think it was a tremendous victory. We won everything we went in there to get.